morning, everyone, and it's been a real pleasure to be here this morning, and I was able to be here for part of yesterday's session as well. So much of what I had planned to say has really been covered a lot. So my remarks are going to be shorter than I had originally planned, which is just fine. After hearing Isabel's presentation this morning about what a community health worker does, I guess I asked myself, as probably many of you asked yourselves, is this a job you would like to do for a living? Flexible or fluctuating paycheck, irregular hours, being on call for 10 hours a day but only being paid for the hours that you work. How do you do all this and pay a mortgage in Burnaby or Colwood or Kelowna? How do you do all this and raise children, support other family members? This is very demanding work, as both Isabel and many of the other employer representatives here have characterized. It is very challenging work. It's one that community health workers get into knowing it's challenging, but sometimes those challenges are more than most of us would want to bear. So what I want to sort of communicate is a position of our union. I myself am not a community health worker. I've never been a health worker. I'm a researcher with our union. So I don't speak to this issue from a place of lived experience, but just from having worked with our membership, which numbers about 7,000 around the province who do work in community home support, both for the health authorities as direct employees, for contracted service providers, who both on the not-for-profit and for-profit contracted service providers who provide public home support. And our union has been proud to represent community health workers since the provincial program has existed in the 70s and 80s through the 90s and the last decade through the many changes of the program. And we are the largest union representing these workers. This is a wonderful workforce to represent. They are dedicated healthcare workers and care workers. Somebody used the term yesterday, salt of the earth. That's a very good term to describe community health workers who work hard to provide a service for people that they care deeply about. Largely now, that's more and more of the senior population, but it also includes people living with chronic conditions, disabilities, and mental illnesses. They have lots of ideas about what could be done to strengthen home support. And I want to just say, too, that, you often hear about unions only when it comes to issues like contract negotiations and strike votes and things like that. That is certainly part of the work we do, but our union, as well as Hospital Employees Union and the United Food and Commercial Workers, who also represent home and community care workers, are part of building the system of home and community care. We have a vested interest in the strength of this system. We have a vested interest in it working well so that people's needs are met, and that the workers who do that work are recognized and supported in the work that they do. So we are involved in a few other initiatives to strengthen home support that I'll talk to you about a little bit in a moment. Fundamentally, we believe that working conditions for healthcare workers are linked to the caring conditions of the care that people receive. So by addressing some of the chronic challenges in the working conditions, that will serve to strengthen the caring conditions. And as we've heard over the last 2 days, and I don't want to go into too much more detail because you'll think we are just all talking on the same page, which in fact in many ways we are, creating more regular employment for community health care workers. The Health Employers Association of BC, kind of maps out the workforce. We know that I believe it's 48% of community health workers hold regular positions. Now that's just regular positions. Some of them are full-time, some of them are part-time, but they're regular, where you work this schedule this week and this is what your pay is going to be and these are your benefits and you're a member of the pension plan. Then 52% of the workforce is casual. And we also know that casuals are not casual by desire. It's not because they're musicians on the side and just want a union job to pick up their hours. They're casuals because there's no regular work in this business. And as we heard from, I think it was Bob Atfield from WeCare yesterday, there are casuals who work 3 to 4 casual shifts for 3 to 4 different agencies, particularly in the Lower Mainland, where that's the scenario. And some casuals work in community home support, but they also work in residential care, cobbling together enough work to be able to feed their families, pay their mortgages, and live a life that they've identified. So the casual workforce and the over-reliance on the casual workforce is a real challenge for recruitment and attention, but it's also a challenge for worker burnout. It's a challenge for the spread of illnesses. When casuals don't have sick days that they can use, they come to work sick, and that illness shares itself around, and that presents itself with its own challenges. We also think that we need to create more fixed-hour positions. So in addition to regular employment, we think that employment should be fixed, that you know what your hours of work are going to be in a given day. Again, that's something that most workers like to know. Am I going to be working from 11 to 6? Am I going to work from 8 to 4? And who's going to pick up the kids? And who's going to have dinner ready on the table? And how is that going to look on a day-to-day basis so you can plan your life? So fixed-hour positions are a goal of our union. We also believe that this sector, the community health sector and community health workers, deserve parity with their counterparts in residential care. And, Isabel has actually outlined that she thinks they maybe even be worth more. I don't think we've made that demand at the bargaining table. I think we're still trying to keep up with residential care. But if the Employers Association wants to advance that position, we'd be happy to take that, I'm sure. Because as Isabel really... as Isabel's really characterized, the work of community health workers does require, the complex range of skills and abilities, but also that ability to work independently without the backup. Lou identified sort of realistic and standardized time allocations to perform the tasks of their work. That is a challenge. And the time to travel between workers, or between clients. The occupational health and safety issues that our workers face, ergonomic issues, the MSI issues that Isabel talked about. When you're going to a new workplace every hour and things are at different heights and different levels, your body has to adjust in certain ways. And then there's the issue of steps and stairs and sidewalks and these kinds of things. It creates a great amount of uncertainty and a need for the body to respond, and sometimes that's not optimal. Working alone has its own challenges with, dogs, violence issues, threats, and frankly, travel and traffic can also be a challenge. And another issue that our members are very concerned about is the way that the service is designed in BC, now moving towards a more competitive model, the tendering process that Isabel referred to, that, you don't know if your employer is going to be your employer for 4 years or 10 years or 2 years or 3 years. And I just think, would we allow that in the public school system, to think, here's a public school. You've got the contract to provide K-12 education for 5 years, and if you don't do very well while you're out, we'll hire a new set of teachers and a new administration. I mean, we don't have these standards in other elements of our public service, and why do we accept this as the model in this vital healthcare service? So that is a challenge that increasingly we have to manage, because community health workers don't have what we call successorship in their collective agreement. So if their employer loses the contract, they don't have the right to be employed by the next contractor, despite the fact that they're trained and capable and have been performing that work under terms and conditions that are provincially set, for the past time. So I wanted to just speak very briefly about some ways in which our union is really helping, we hope we're helping to strengthen home and community care, in particular community home support. We've been involved in the establishment and the oversight of the Care Aid and Community Health Worker Registry. Bruce Bell here as the Executive Director, CEO, because our members are also very concerned about elder abuse and ensuring that there are safeguards for the elderly and people who are vulnerable. But we also wanted to link it very much to a fair process for workers who are suspected of abuse. Too often we hear the case that there's a complaint made about abuse and the worker gets fired without a due process and recourse and a full investigation of what the facts were. And furthermore, with an emphasis on training, are there training deficiencies that have resulted in the scenario that came about? And can we use this as leverage to ensure that there are standard levels and improved levels of training for community health workers? We've also been involved in the development of the health care aid curriculum that's now used at BC public post-secondary institutions, and we support the Ombudsperson's recommendation that this curriculum be, standardized at the private post-secondary institutions, and that there are standardization of this curriculum. Through our collective agreement, we do have training funds available that we administer to provide individual training to individual community health workers or LPNs. And one of the things we are doing, as Winona described yesterday, is we're partnering to develop a training module for schedulers so that they not only have the technical skills using their software, but also the complex set of skills that are needed to match client needs with worker needs and agency needs. And, you know, we are engaged in the Seniors Care Sector Committee that Winona described. And as well, we do political advocacy to strengthen home support. And we do that in partnership with like-minded organizations who share common goals. So I just wanted to end on just some of the advocacy. The Ombudsperson's report is sort of the area where we feel is the most logical place to get behind in terms of a credible, evidence-based, you know, extensive overview of some of the systemic challenges, but then also some of the opportunities to correct them. And we really would support political leadership at all levels, but starting with the Ministry of Health, to ensure that these recommendations are given a fair evaluation and, frankly, an implementation. The one recommendation that just kind of blows my mind is the one where she calls on government to do a review of the provincial home care program, whether it's meeting its goals, and have that done by October 2013. And I think right on, like, put a timeline on it, give it a mandate, and let's do it. You know, there are these honest conversations that are happening and are happening with more frequency, and I do also commend SFU for providing a space for some of these things to happen. But what I think is really needed is provincial leadership, and where can we go with that? The last piece I do want to also mention is, you know, the Ombudsperson talked about non-medical home support. And this is an area that used to be very much a part of our members' daily work, the provision of non-medical home support, and that has been eroded out of the system with some consequence. One of the consequences is it didn't exist. I mean, it doesn't exist for many seniors in their communities. Government's response has been to partner with the United Way to establish a separate program to support these things. But is that the best response? Our feeling is that that's work that can be done by community health workers, community health worker level 1. It could be part of a public home support system, and that should be examined before it's discarded. And what does that look like? So because we feel that would then ensure the safeguards, the training standards, and the occupational health and safety issues, both for the clients receiving those supports and for the workers providing them. So I just want to conclude, because I'm sure my time is up, that, you know, we are committed to strengthening the home support system. We do believe that working conditions are linked to caring conditions, and you have to examine both in the interplay, again, as Isabel really kind of characterized. And there is a lot of agreement about what needs to improve in the public home support program. I think the challenge now is how is it going to be improved specifically, and when? So we do look forward to being a part of those discussions, and I think this conference has been really has helped to shape some of those conferences. So thank you for the time.